NBCSN was formed through the National Association of School Nurses. Back in 1984, NASN did a Futures Projects Committee to propose the feasibility of a certification exam. And in 1985, they partnered with a testing firm to develop and administer that exam.
The National Certification of School Nurses, NCSN, is really the gold standard of school nursing practice. And it was created exactly because there was no national standard. So this is a way to say this group of school nurses has met all of these rigorous standards.
School nursing is a full spectrum of care. You have school nurses that are caring for children as young as 5 and 6, and in some cases as old as 20 and 21, because we do have special needs students as well who are in school longer. And if you think about all the health ailments that can affect you between those ages, you start to recognize that they need to be an expert and they need to know a lot. And the NCSN credential helps to provide validation that they do, because we test on the full spectrum of care that a school nurse could have to provide.
School nursing for way too long has been a hidden healthcare system in our country. And I think it was through COVID that this spotlight has been shined on the importance of the role of the school nurse.
School nursing has changed a lot during the COVID era. And I know that when you speak to, our board members, that they're going to tell you how much it has changed. There's a lot of work that our school nurses have had to take on to ensure that children are coming to a place where they're safe, where they're going to hopefully remain healthy. And if there is exposure, that they're notified appropriately. Contact tracing is a lot, and a lot of the school nurses have been charged with doing contact tracing within the schools, and it takes a lot of time to do that. So on top of their long day in the school already, they're now doing contact tracing many times after hours. They're not necessarily getting extra compensation to do this. And this is for essentially the health and safety of the students, the students' families, and again, the whole community. It's a very vital, pivotal role right now.
Unfortunately, some of us have gotten into difficult conversations with parents because we are giving them information that is hard to hear. Has their child been exposed to COVID and has to now quarantine for 10 days? Is their child positive? It's been a rocky road through COVID because of all of the public health mitigation strategies that we have to implement for safety.
School nurses are so important because they are there to ensure the health and wellness of the school community. The school community includes the students, the teachers, the administrators. It even can include students' families and ensuring that there's health and safety there as well. They are many times the front lines for some of these kids. They're looking for signs of abuse. They're looking for signs that a child, is being fed. They're looking to ensure that children are staying healthy. We did have an NCSN who recognized that in her community, access to dental care was really, really difficult. And she worked with a local dentist who also volunteered his time and skills and expertise to come to the school. I think it was like 2 or 3 times a year to check on the students' teeth and to provide basic cleaning services at no cost to the parents.
I'm a preschool nurse in Camden, and we had a new student who had come. She was not documented. She had come from a part of Guatemala. But when this little girl came, the staff noticed that she wouldn't eat. She would take the food right off the plate and she would put it into her pants pockets. She did that for breakfast and she did that for lunch. And the director called and said, I don't know what to do about this little girl. She's filling her pockets with food every day. So we found out that she was bringing home the food to her family. She, at 4, felt responsible to feed her family. And here was food that they didn't have on their year-long journey. So our school got together and created a food pantry to get them started until her family got on their feet a little bit. And that little girl went on to become the little valedictorian of her class. She so blossomed and flourished and spoke in front of the whole class. It was really a great, amazing transformation. is so important for people to understand, not just the tasks that we complete, but the impact that we've had on our students.
When students are healthy, when their bellies are full, they're going to be better students. They're going to be able to pay attention in class. When the school nurses, when they meet that minimal requirement to do their job, that means they're going to be doing a better job for the students. And the better job that they're able to do, then the better and healthier the students are going to be.